Hello everyone, Dr. Deke Fobi. We will continue our talk on dementia. We talked about the global deterioration scale of 7 stages of dementia. We talked in our first video about stage 1, 2, and 3. In our second video, we did discuss stage 4 and 5. And today we'll be discussing the final stages of dementia, 6 and 7. So, brief recap of the earlier stages. Stage 1, the no stage, meaning absolutely no normal. There's normal outward behavior. There's no impact in life. There's no dementia visible, but changes already have been going on in the brain and have been going on for multiple years. We go to stage 2, which is where we see very mild changes, or I call it the U stage, when you're beginning to see the signs yourself of forgetfulness and you're beginning to notice that something is not quite right. And you're beginning to notice that you're not performing as well at work, but people don't notice. We go to stage 3, where people are beginning to notice. Family members are noticing that something isn't right. Co-workers are noticing that something isn't right. You're missing appointments, you're misplacing car keys, you're having more difficulty managing your medications, and you're having more challenges at work. So this is beginning to impact your life. And this is the stage where when you see a practitioner and you have testing done, we can actually detect this. This is the mild cognitive impairment. And up to stage 3, dementia or memory impairment can still be reversed. So now we go on to stage 4, which I mentioned in the last video, which is the early stage dementia. We're beginning to see moderate changes. This is the stage where people are having more difficulty making decisions, healthcare decisions. They're having more difficulty using things like the phone, the laptop, remembering how to do things. They're having difficulty with sequencing of things, using the right words, and they talk about things instead of naming them. I need something I write with instead of saying I need a pen. This is the stage also where they're having marked difficulty with problem solving. And at this stage, everyone knows that this is no longer just plain old memory loss. And so stage 5 is when the independence starts really declining. And this is considered the mid-stage dementia. And this is the stage where they're repeating the same questions, asking you the same things over and over, becoming more confused in unfamiliar environments, having more difficulty with sequencing of action. They go to the bathroom, they don't remember, do I take my underpants off first or do I just go? This is a stage where they may not remember how to flush the toilet. And this is the stage where they get confused and they can't make the proper judgment of it's cold outside, I need my jacket, or it's hot, I need my pair of shorts. Okay, so that's stage 5. So now we're going to go into the severe stages, which is the end stages of dementia, stage 6 and 7. And this is also the stage that is really difficult for family members. In stage 6, it's impacting the life in a very severe manner. And the patient cannot make healthcare decisions, and at this stage they need 24-hour medical care. This is a stage where they have more mood swings, personality changes, some become aggressive, some just don't care, there's apathy, lack of caring. This is a stage where they wander and they can get lost. This is a stage where their sleep cycle is disrupted. They may be awake all night, sleep during the day, and they're not aware of time anymore. The time is no longer the same time frame that we see. They really do not recognize time anymore. So concept of time is really diminished. So this is a stage often when people don't recognize their loved ones. They see their child, that's an adult child, and don't recognize the child because they remember the child as a baby. They see their spouses and don't recognize them because they remember them from 30 years ago when they had a six-pack belly and they were, or when if it's a lady, when she had the perfect figure and looked a lot younger. So they don't recognize their spouses. And they would often look at the husband or wife and say, where is my wife? This is the stage also when we have difficulty with eating. Why? Because they don't remember how to swallow anymore. You give them something to eat and you have to remind them, okay, chew it. And then when they chew it, you have to remind them to swallow. They may still be able to do some hygiene. For example, you keep them in the bathroom and give them a toothbrush and toothpaste. They may not remember how to use it, or they'll brush one side of the mouth and you have to remind them, hey, brush the other side. And then you have to be there to remind them to spit out the toothpaste, or they may swallow it. In this stage, difficulty speaking is also very notable, and they don't engage in conversations much, fewer words, and they're more to themselves. They are less social. They don't mingle as much, and they have difficulty dressing, difficulty with sequencing, when they might not remember that they need to put on their shoes after they have their clothes on. So they may put on their shoes and then try to put on the pants. They may put the left foot on the right foot. They may not remember that the sock goes on before the shoes. They might attempt to put on socks on the shoes. So this is a stage that you really is very trying for families, and you need to exercise a lot of patience. And in this stage, you really need to be there 24/7 for this patient. What makes it even worse is that they now notice bladder problems. There's bladder incontinence, there's fecal incontinence at this stage, and the patient is unable to express their needs. This is a stage where you sometimes see them go to the kitchen, open the refrigerator, and urinate in the refrigerator. And this is a stage also when ambulation becomes a challenge. They don't ambulate as much as they used to. They don't remember how to walk. They don't remember how to put one foot in front of the other, and so forth. And this continues on and goes to the late end stage of dementia, which is stage 7, which is very severe mental decline. It is the final stage, and the very severe impact on quality of life. Patients tend to lose the ability to speak completely. They lose the ability to eat or swallow. They start eating less. You have to be careful so they don't choke. You have to remind them to swallow, and even at that, they may not remember to. They're unable to use a toilet. They're unable to get dressed alone. They can't walk or sit without help. Even if they're still walking, they would stop and not remember what to do. There's loss of muscle control, which leads to inability to ambulate. They might be confined to a wheelchair or to a bed, and they often cannot recognize family members. Almost always they're disoriented, and they sleep a lot more, talk a lot less. They could go from one stage to the other. So you might have occasional awareness. All of a sudden they're aware, and you wonder, wow, what happened? It's like a light bulb just got turned on, and then the next minute they lose that awareness. 6th and 7th stage of dementia are the end stage, and are very, very challenging. And I will discuss more what we can do at various stages to be able to help for those of you that have loved ones in those stages. At this point, there is no reversal. We cannot reverse the damage to the brain. It's been a damage ongoing for a long, long time. And so at this stage, it's really too late to do anything. Well, I know this was long, but I hope that gives you an idea of what those 7 stages are of dementia. In summary, 1st stage, everything is good. 2nd stage, very mild changes that you've noticed. 3rd stage, people are beginning to notice. 4th stage, early stage dementia, we're having more challenges, increased difficulty problem solving. 5th stage, it's really the mid-stage dementia getting a lot worse. We're beginning to see behavioral changes, mood swings, paranoia, accusation of infidelity, things like that. More difficulty with sequencing, more difficulty with dressing appropriately, and eating difficulty, and some initiation of bladder issues. 6th stage, this is more pronounced: difficulty eating, difficulty with speech, difficulty getting dressed, mobility is compromised at this stage, and you're becoming almost totally dependent on loved ones. And the final stage of dementia, which is very, very difficult: loss of muscle control, inability to walk, confined to wheelchair, to bed, 24/7 care, and again, difficulty swallowing or even eating at all. And this is how it ends. So basically, 7 stages of dementia. We'll talk more about them on our future videos. So thank you. You all take good care of yourself. Remember, brain health, we've got to prevent this before we even get to this. First 3 stages, we have a chance. We can reverse dementia at those early stages. So inbox me, or if you're interested in ways to do this, and we can talk more about them. Thank you, Dr. Deki Fobi. It's been a pleasure.